The month of November is Diabetes Awareness Month, and today I want us to talk about diabetic retinopathy, how diabetes affects your eyes. Now, diabetic retinopathy is a complication of diabetes which affects the retina of your eyes. When your sugar in your blood increases, they tend to block the tiny vessels that supply nutrients and oxygen to your retina. And when this happens, your eyes try to produce new blood vessels that can supply nutrients to your retina. But these new vessels that are produced are weak and they tend to leak fluid and blood in your retina. This leakage now can cause what we call floaters in your vision, and they can as well cause swelling in your vision, your eyes, in your retina, which can lead to a series of complications. And that is why you have visual disturbances when you have diabetic retinopathy, which I will not start to list now because they are too numerous. Which people are at risk of developing diabetic retinopathy? Someone who has a long-standing history of diabetes. Probably you've had diabetes for a long period of time. You might be at risk of developing diabetic retinopathy. Probably you have diabetes before getting pregnant, or you had diabetes when you became pregnant. That is what we call gestational diabetes. You are at a higher risk of developing diabetic retinopathy. So I would advise you go for frequent eye check, dilated eye examination, not just ordinary eye examination, dilated eye examination, because you'll be saving yourself. Now, which people are at risk of developing diabetic retinopathy? One, like I said earlier, people that have long-standing history of diabetes. Two, people that smoke. Three, people that have high blood pressure. 4, people that have high cholesterol. 5, pregnant women, and so many other risk factors. I'm not saying that if you have diabetes, you must develop diabetic retinopathy, but you are at a higher risk of developing diabetic retinopathy. And trust me, you wouldn't like to have that. So I would advise you go for regular eye checks, because regular eye check, dilated eye examination will actually help to preserve your sight from diabetic retinopathy. Monitor your blood pressure, monitor your sugar level, monitor your cholesterol, exercise. If you're obese, you're also at a risk of developing diabetic retinopathy. So I want to add my voice to that of the whole world to encourage you to for regular eye checks and then monitor your sugar level to avoid diabetes and diabetic retinopathy. I still remain Dr. Johnson. If you've not followed me, please kindly hit the follow button. Share this video to your friends, your family, or anyone you know that has diabetes or is pregnant at the moment. Let them follow and like the video. Drop questions and comments in the comment section. Thank you.